This 67-year-old male patient had to have teeth 1.5 and 1.6 removed because of caries. The extraction sockets were left to heal for 8 weeks. An intraclavicular relieving incision and a mid-crestal incision will be performed. The panoramic X-ray shows sufficient bone height. Nevertheless, an alveolar bone defect can be expected. 2 4.1 Straumann bone-level implants with regular crossfit connection will be inserted. A 14 mm implant in position 1.5 and a 12 mm in position 1.6. A surgical template will help to insert the implants in the correct position, ensuring ideal inter-implant distances, as shown in the mirror view. After local anesthesia, intraclavicular relieving incisions are carried out using a small blade, number 15. In posterior zone, a mid-crest incision is made. Distally, an additional relieving incision is performed. This allows the elevation of a good-sized flap using a sharp, mid-size elevator to ensure good visibility of the treatment area. Remaining granulation tissue is removed with a sharp spoon. Now the expected socket defect becomes visible. To begin, the first round burr is used. The surgical template helps to mark the 2 implant sites. The marks are enlarged with the second round burr. A check with a caliper confirms the correct inter-implant distance of 7 mm. In addition, a minimal distance of 3.5 mm from the center of the implant shoulder to the adjacent root is required, as shown in this graphic. Under constant cooling, the implant bed is prepared to a depth of 14 mm using the blue-marked single-patient pilot drill at 800 RPM. The correct depth of 14 mm is verified with the 2.2 depth gauge. To check for parallelism during the preparation of the second implant bed, the anterior depth gauge remains in place. To ensure correct 3-dimensional positioning, the assistant's help can be very beneficial. The second implant bed preparation is also verified with the 2.2 depth gauge. The first preparation is enlarged with the yellow marked pilot drill at 600 RPM. Parallelism is ensured with a depth gauge left in the implant bed of the second implant. This position is verified again. The second implant bed is also enlarged with the second pilot drill. High-quality drills, controlled speed, constant cooling and intermittent drilling help to prevent overheating of the bone. The inserted depth gauges with the built-in 5 mm platform show the correct prosthetic-driven implant placement, as shown here in the mirror view. For the insertion of a Straumann bone-level implant with a diameter of 4.1 millimeters, the red-marked twist drill is used at a speed of 500 RPM. The 3.5 depth gauge is used again to confirm the correct depth and to check for parallelism during the preparation of the second implant bed with the twist drill. The last control, with the 2 depth gauges, confirms correct sink depth and the correct position underneath the surgical template. The lateral view shows the parallelism of the prepared sites and shows the future correct implant shoulder level of 3 millimeters below the prospective crown margin, represented by the surgical template. The preparation concludes with shaping the conical region of the implant bed with the specific bone-level profile drill. The dip on the head makes the instrument easy to distinguish from other Straumann profile drills. The cylindrical part of this drill gives it good guidance in the prepared implant bed. A speed of 300 RPM is used. The 4.1 Straumann bone-level implant with regular crossfit connection and SL active surface is removed from the ampule. A click is heard when the adapter is connected correctly. In this case, the contra-angled handpiece is used to insert the implant. No cooling is needed, as the speed does not exceed 15 RPM. One of the 4 markings on the transfer part has to be on the vestibular aspect. As bone density at position 1/6 is higher, the BLTE marked tap is used over the full length of the implant bed at a speed of 15 RPM. The second implant is also inserted with the contra-angled handpiece. Again, to simplify future prosthetic reconstruction, one of the 4 markings on the transfer piece has to be located on the vestibular aspect. To detach the transfer parts, the holding key is used for stabilizing the octagon. The transfer parts are detached in counterclockwise direction. After cleaning the internal connection, 2 conical 4mm magenta color-coded healing caps are inserted for transmucosal healing. The flap is mobilized by cutting the periosteum to allow for a tension-free soft tissue closure. The mucosa is further prepared for a nice, soft tissue adaptation using the punch technique. The flap is adapted by interrupted single sutures using 5-0 Gore-Tex suturing material. The final mirror view shows excellent implant positioning and a nice tension-free soft tissue adaptation. The periapical radiograph, taken immediately after implant placement, shows the 2 Straumann bone-level implants ready for a 6 weeks transmucosal healing. For further information about the Straumann dental implant system and the Straumann bone-level implant line, please contact your local Straumann representative.